Welcome to the Global Health Equity Miniseries. I'm your host, Harvey Kennedy-Pitt. Join us as we look at 8 public health principles that can help health systems build capacity through adaptation. Brittany, welcome to this episode. Thank you so much for choosing to be a guest and agreeing to be a guest, I should
Thank you
say.
so much for having me, Harvey. It's a pleasure, Dr. Harvey. My name is Brittaney Jenkins. I am the founder and CEO at Jenkins Public Health Consulting. I'm a certified health education specialist with over 15 years of experience working in healthcare and public health. I'm currently located in Birmingham, Alabama, but originally from Indiana and have lived in other states across the United States, and may keep traveling. We'll see where it goes. But yes, founder and CEO of Jenkins Public Health.
I see. I mean, you kept it nice and snappy and simple, but really bite-sized, which is really great. And I guess the point of this conversation is really to explore your background. I think some people will be students, some people will be long-term practitioners, some people will be kind of in the middle, maybe even thinking about leaving the field, or.
Mm.
So we want to try and remind people what people are doing in the field to encourage them. So what's kind of your background a little bit, and how did you get to where you are now?
Yes, it is definitely an everyday task for me to encourage people to stay in public health or to, get into public health. So what got me into public health was I was actually going to college to be a pediatric surgeon, well over a decade ago. And when I was working in hospitals on my road to become a pediatric surgeon, I noticed that patients were there for things that could be prevented. And it shocked me to the core. When I noticed that work inside the hospital, I was too emotional for it. I was
Mm.
spending a lot more time with the patients than I was allowed to. And I say that in a way to understand that, your job this isn't your role. But I knew that I had a deeper calling for the work that needed to be done. So while working in the hospital, I noticed that I need to do more than help with the treatment, but to be on the prevention side. And that's when the degree of public health came up for me. And then public health degrees weren't really talked about. I graduated from Ball State University, and that was a great program. It really immersed me into what public health really looked like. And ever since then, for over 15 years, I've been working in the field of public health and supporting healthcare organizations and strengthening their approach to prevent, not only treat. And so public health is everything to me. Public health is everything around us. I've worked in many different areas of public health, not just the hospital, but rehabilitation centers where patients had injuries that they succumbed to for different reasons, not just lifestyle. But also,
Yeah.
I was an environmental health specialist, so I know that the roads and the water and the air that we breathe is public health, is prevention, and then what we need to do to maintain it. Community health worker, I did health screenings, and then I really did a lot of work in chronic disease prevention, overseeing 7 different types of chronic diseases that affected our community every single day. And that's where I really landed in my career, was doing a lot of chronic disease prevention work. As the CEO of Jenkins Public Health, I really support organizations in designing or strengthening their existing programs around chronic disease prevention or injury prevention so that they can not only have stronger programs or partnerships, but also get funding on repeat because they have a strong program. And then they're reaching the people that they aim to serve, and that they have partners who are at the table who are excited and engaged and pulling their weight. So yes, chronic disease and injury prevention is really the heart of everything I do.
Amazing, amazing. So obviously you were sort of alluding shortly, sort of briefly there, about the types of people that you get to work with. So tell me a bit more about the types of clients, communities, or stakeholders that you work with, and maybe even who you don't work with. It's just to
Yes,
delineate those two things.
yes. So chronic disease is a big category, and so is injury prevention. But I do work with hospitals, health departments, a lot of nonprofit organizations who have any type of health focused program. Chronic disease is my love, but we do help with other programs as well, but mainly health departments, even pharmacies. We've helped pharmacies design self-management programs around managing diabetes, type 2 diabetes, and it's been highly effective. Those organizations continue to get funding for these programs because it's not just something that's been designed and they get funded for, but they actually have processes to make sure it's effective for the people, and they have partners at the table who are helping this be sustainable. We also work with what is foundations. So we've done some initiatives with a foundation who was focused on drowsy driving. which was super interesting. It wasn't something I ever had heard of. And then when I realized drowsy driving is an issue and the rates of people who are dying or injured due to drowsy driving, I became very not only interested in helping this organization, but an advocate myself. So those are some of the organizations, a lot of nonprofits and for-profit organizations. There's even organizations who are aiming to prevent cancers that we help to design effective marketing and outreach to get early detection and screening.
Amazing. I mean, it's such a robust approach, and I'm so glad that you're introducing some new concepts, particularly for those who are
Mm-hmm.
based in other regions of the world who kind of would never have heard of that. I've never heard of drowsy driving. Obviously, we've heard of drunk driving, or it was, as I say, in the UK,
Mm-hmm.
drink driving. And so we have sort of that in the back of our heads, but drowsy driving, which is we know can
Mm-hmm.
often mimic the characteristics of being intoxicated while driving, and so it's
Yeah.
actually quite an issue. So,
Yeah.
the focus for us on this series is really to emphasize the principles. Sometimes we're so busy, haven't really got capacity, we're rushing around, we have
Yeah.
a very large workload, but then we forget what the principles are of what we're doing. And so there's 8 principles that we sort of focus on in this series. And we have had a brief conversation about the one that you can focus on. And what is that one that you like to focus on?
Health equity.
And I'm curious then, what problem you would be trying to solve through the work that you do. What specific one? Maybe one or two.
Yes. With health equity, the problem that I'm trying to solve is really making sure that people have access to the programs that exist. A lot of the times, the organizations that I'm working with, they're like, oh, we've been around since the 19 whatever. People should know by now. But when I look at what they're doing and how they've been marketing or partnering or implementing, or even with the transformative outreach, it's a lot of leaks in the pipe. And so when we go plug those leaks, it makes it more effective. So health equity, we're really making sure people have access to the resources that are available to them and helping organizations strengthen what they're already doing or what they aim to do to make sure that's happening.
I mean, so you could have chosen autonomy, you could have chosen efficiency, you could have chosen anything else. So what was it that sparked your interest in that particular principle?
That particular principle really sparked my interest, and it goes way far from when I was a child. I was raised by my grandparents. I was adopted due to some unfortunate situations, and they were really philanthropists. We were in the community every single week, almost several days a week, really making sure that people had the food, the shelter, the healthcare that they needed. And my family, they didn't have a background in healthcare or public health, but the things that they were doing was actually public health. And so I realized at 6, 7 years old that everyone doesn't have equal, not even equal access, but the access to live a healthy life or
Yes.
live a quality life, right? And so how can we make sure that what people need, right, based on their unique situations, they can get access to that, right? And so I've been doing that from a very young age, and that's what really sparked my interest. And I know that every community is different, but every community does have a need.
Which is so important because if you ask many practitioners what the difference between equality and equity is, they still can't tell you, and they've been in the field for many years.
Right.
You've really got
Yeah.
to articulate specifically what equity is and how it drives
Yes.
health, well-being, and drives equality ultimately
Yeah.
as a concept. So I'm wondering, there's lots of people doing this work. There's lots of people saying they work in equity. There's lots of people saying they work in public health or within
Yeah.
health. And I'm just curious about how you think we can make all of this amazing work that we say that we're doing really and truly meaningful.
That has helped me really understand that, organizations have unique needs, even if they are doing similar work. I've developed a proprietary 5-step community impact framework that really works with organizations through these 5 key areas that are very simple, high level, to really make their programs more effective and for them to advance health equity. Achieving health equity will be a lifetime of our work because there will always be inequities for things that we can't even prevent, right? It is happenstance, but how can we advance our efforts to be more equitable? But at the basis of it all, to advance and achieve health equity, I really truly believe that all staff and stakeholders should be focused on addressing their biases and operating with empathy. And I work with organizations who've been doing things for decades, but at the same time, when we have these conversations and we do our assessments to these organizations, we realize there are needs for bias training. There
Mm.
is more conversations around empathy that need to be had so that our work can be effective, right? We have a lot of assumptions about people that aren't true.
Yeah.
We have a lot of things that we're saying to our colleagues that are actually inappropriate and not a joke, because that affects our work, right? It's kind of like what you think about yourself internally can be said, can be felt externally or seen from other people externally. It's almost the same thing as that. So understanding there's over 170 different biases and that we
Wow.
all have them. There was a survey that was put out about people and do they have biases? And I believe 97% of people said that they do. And not everyone has a bias. You might not realize you do because some of them are internal, unconscious. And then a lot of them can also be conscious, right? You're deliberately talking about your biases. You're deliberately preventing access to care or treatment or literacy because of your biases, right? There's this favorite one that I love to talk about, and it's beauty bias, right? I look together today.
Mhm.
I look like,
Okay.
I have it all together. So you would think that, oh, she hasn't had any struggle. She has it, she has this and that. But that's a bias. You can't assume based on what people look like and that they're put together that they don't have a need,
Yeah.
right? And so that's the whole thing around health literacy as well, when we're making sure that people have the resources and understand it to improve or maintain a good quality of life.
Absolutely, absolutely, and really well articulated. And I think that people really tend to enjoy listening to these conversations. They say, "Oh, what a great conversation!" Brittany was so great, and she said things, but they don't know what to do next. They've just watched the episode, they end the episode, they move on to the next thing that they're doing, and there's no sort of action plan for them, as it were. And so, I guess my next
Mhm.
question there is, what is your call to action for people who are
Yeah.
listening, and sort of what do you want us to go out there and do so that we can join forces with what you're doing?
Yeah. If you are a health focused organization or staff and leadership of organizations and you're looking to improve your programs, improve outreach, improve your partnerships, contact me and we can talk about our 5-step community impact framework and how it does work for your organizations and positions it to get funding on repeat. We also have a on-demand training called Amplify, which helps organizations strengthen their marketing and community outreach so that they can reach more people that they aim to serve. And in doing so, you get positioned for new partnerships and more funding. That's why I like to say funding on repeat, because it is possible without applying to more grants, right? Because you
Mhm.
have to have those programs and processes in place so that you can look more attractive to these funding agencies. I've managed over 10 million in grants and won 10 million in grants over the course of my career. So I know a lot of what they're looking for, and doing applying to more grants isn't always the best answer. We
Mm.
also have a health equity guide that you can find on our website, jenkinsphc.com, Jenkins Public Health Consulting.com. And it's for instant download, and it includes some AI prompts that you can use to look at the performance of your programs and partnerships. So thank you so much, Harvey.
Wow, I mean that is, it really helps for us to know what exactly we do, so that when someone asks us, "What do you do?" we can articulate it with as much tact and skill as you just have. And you started to talk about your website and different things, which leads to our next question, which is, people will want to get in contact with you, and they would have listened to the episode but not know how to do that. How can people find you if they want to get in touch, or they just want to, do an exploratory call with you, or even want to, become a client of yours?
Yes, for sure. And I'll say my website again, jenkinsphc.com. You can also follow me on LinkedIn. It's Brittany, Brittaney Jenkins. I'm on YouTube and Instagram as well, Jenkins underscore public health.
Amazing. You make it so easy. We have no excuses. We've got to get in contact. So, you're really wanting people to have a transformational experience, not just only if they work with you, but just generally because you feel that really deeply within your spirit, to say that you want people to
Absolutely.
have a better quality of life, you want them to have better outcomes, and to experience better access to what's in many cases right in
Absolutely.
front of them. They just can't make that final step. So, whether you're working with
Yeah.
individuals or working with organizations, I look forward to seeing, the impact that you create. I do follow you online. I see the work that you do. I listen to your stories, and you absolutely know what you're doing, and that's always a great thing.
Thank you.
So, super proud to be in your wider circle, or even be acquainted with you. And we look forward to kind of seeing the impact as it goes forward. So thank you so much for being a guest
Yes,
today,
thank you
and
so much.
thank you for your time, whatever time it is now in your time zone. But thanks so much for being a guest.
Absolutely. Thank you.